In this section, I want to tell you a bit about arboviruses. So the term arbovirus does not refer to a taxonomic classification. Instead, what we're talking about when we say arboviruses, what we're talking about is viruses that are arthropod borne. These are viruses that you get when you are bitten by an infected arthropod. Usually we mean mosquitoes, but ticks can also transmit arboviruses, other arthropods as well. There are 4 major genera that have arboviruses in them: alphaviruses, flaviviruses, bunyaviruses, and arenaviruses. So first we'll talk about alpha and flaviviruses. These are enveloped, positive sense strand RNA viruses. They have a very broad host range, including vertebrates and invertebrates, which is why they can be transmitted by arthropods. They are zoonoses acquired from animals. Pathogenic alpha viruses include many of the equine encephalitis viruses, and a virus that's considered to be an emerging infectious disease. It's called Chikungunya. So Chikungunya, translated, it means that which bends up because of really painful arthritic symptoms. So especially in like the small joints of like the fingers, you have arthritis symptoms that can cause the fingers to be kind of misbent, I guess is the way to say it. They're not like broken, but they're kind of, if you flexed your hand out, and it's really hard to see in a class that's virtual and online, but if you kind of flexed your hand and how your fingers, if you flex it all the way, your fingers kind of look like they're bent up, something like that. So in the US, we have seen chikungunya, and we have seen it as a locally acquired viral infection, meaning people who were in the US who had not traveled outside of the US got the infection, and that was in both Florida and Texas. And so what that means is that there were, thousands of people who traveled outside of the country and got chikungunya when they were in another country. But when some of them came back, there were 12 people in Florida and 1 person in Texas who were then bitten by a mosquito that had fed on one of those travelers. So they hadn't left the country, they just got it because it was circulating in the mosquito population. So as of right now, we don't have a lot of locally acquired chikungunya. And it's not because we don't have the mosquitoes, and it's not because there aren't people present. We haven't reached enough infected people to really establish the infection within the mosquito population. And one of the things that we should be concerned about is how climate change may lead to changing ranges for disease vectors. So with the expansion of disease vectors, with more and more potentially of these mosquitoes in the US, these numbers may go up. Not a guarantee, but it is possible. So those are the alpha viruses. Later, we will talk about another alpha virus, but it's not an arbovirus, so it's a separate one. There are also flaviviruses that are transmitted by mosquitoes. There's another one that we'll talk about later that's listed here, hepatitis C. But flaviviruses include dengue, which is also sometimes called breakbone fever. There's yellow fever, West Nile, Zika, and the majority of them are transmitted by mosquitoes belonging to either the genus Aedes, like Aedes aegypti, which is a really dangerous mosquito to have around, and also Culex mosquitoes. There are some that are transmitted by other genera of mosquitoes and some that are transmitted by hard ticks. So these here, you're kind of looking at the range of some of these pathogenic flaviviruses like yellow fever or even potentially dengue because of the range of the mosquitoes that can transmit them. And then here you have most counties in California, because we do have the potential to have some of these viruses here, but we have vector control districts, and they usually, in some areas, they'll be responsible for more vectors, but in Fresno County, they tend to only work against mosquitoes. So, when we talk a little bit more about these types of infections, one of the things that's really important to think about, which I found really interesting. So those of you in the medical profession or going into the medical profession, even though we think of a lot of these as diseases of other countries, except for West Nile, we have a ton of West Nile in the US. I was at a conference in El Paso a while ago, we'll say. And El Paso is just across the border from Juarez. And our conference was at the University of Texas El Paso campus. And you can go to the parking garage on campus. It's like a 5 or 4-story parking garage. And if you stand up there, you can look into Juarez, because the border between the US at that point, it's the Rio Grande, it's a chain link fence, and it's I-10, the highway I-10, which I think is either 4 or 5 lanes in each direction. So it's not a lot. You can literally see people I think there's a Walmart, there's like a pizza shop right across the border that you can see with your eyes. You can watch people walking around in Mexico. And the thing that one of our speakers talked about at this conference was they find patients with dengue all the time in Juarez, but we don't really see it very often in El Paso. But think about it, what stops a mosquito from flying across I-10? Right? Nothing. So the fact that these diseases are literally across the freeway from us is something that you as a medical professional have to be cognizant of, that it is entirely possible, it does happen, that patients who have not traveled to Mexico or to any other foreign country will turn up with these infections. So Zika is one of those that is also sometimes considered to be a emerging infectious disease. It's been found in other parts of the world before it came to the Western Hemisphere. It was a really big deal in South America, especially in Brazil. There were so many patients who got this infection. And the challenging thing about Zika is that if a patient is infected with Zika during early pregnancy, it causes significant birth defects, the most noticeable of which is microcephaly. So the children are born with very small heads. We did have locally acquired cases of Zika in 2016 and 2017. Those were in Florida and Texas. We had a lot of travel associated cases. So it has been here, and there's nothing to really stop it from coming back. What these viruses do is they can attach to receptors on many different cell types in many different species. And each one of them has its own sort of tissue tropism. What makes these particular viruses a little bit more dangerous is that they are cytolytic, with 2 exceptions, rubella and hepatitis C. Rubella is the alpha virus I told you about that we're going to talk about later. Hepatitis C we will also talk about later, but it is not transmitted by mosquitoes. They will establish viremia and systemic infection. They do induce interferon and other cytokines, and that leads to a lot of flu-like symptoms during the early infection. Again, except for rubella and hepatitis C, they are arboviruses. And the flaviviruses can actually infect immune cells. And so what can happen is that can actually lead to enhancement of the infection. So some of our major symptoms that we worry about with our alpha and flaviviruses, almost all of them, when they get into people, will cause flu-like symptoms. Dengue and yellow fever will cause hepatitis. So they're part of those flaviviruses, like hepatitis C. So you get the infection in the liver and you'll get the jaundice. They can also cause hemorrhage and shock. So they can cause lysis of blood vessels. A lot of the other alpha and flaviviruses, including things like West Nile, are more likely in a severe case to cause encephalitis rather than hepatitis, hemorrhage, or shock. They can cause cell death through different means. They can block host mRNA binding. They can increase permeability of the cell. They can change ion concentration. They can displace the cell's mRNA. And generally how they're transmitted is that the female mosquito will take a blood meal from a host that has virus circulating in the bloodstream. So the person is viremic, or the animal is viremic. The virus will infect the epithelial cells of the midgut. It will move into the mosquito circulation and eventually get into the salivary glands. Then when the mosquito takes another blood meal, the virus is regurgitated back into the host. One of the important kind of ecological factors about arboviruses, especially those transmitted by mosquitoes, is they must be transmitted by female mosquitoes. Male mosquitoes don't take blood. They don't bite. So sometimes, like if you're outside and there's a mosquito just like buzzing you, but not biting you, it's almost always a male. And the reason it's buzzing you and like hanging out by you is that it can sense your CO2, but it's waiting for a female to come by because the female will want to bite you. So the male hangs out by you because he wants the female. The female hangs out by you because she wants to eat you. The disease symptoms we see with these viruses are caused by the tissue tropism. If the virus goes to the liver, you'll see hepatitis. If it goes to the nervous system, you might see encephalitis. It can be determined by the concentration of virus that got into the body. And of course, every patient is different. So the individual response can also lead to the disease severity. For example, a lot of people in the US probably get very mild West Nile and don't experience any symptoms, or they experience the mild flu-like symptoms. Very rarely might somebody develop encephalitis. So the symptoms can range from mild, encephalitis, arthritis, that's pretty common with like dengue and chikungunya, or hemorrhagic disease. The initial symptoms are going to be flu-like illness within 3 to 7 days of infection. And again, that's the result of the cytokine response. So fever, chills, headache, muscle pain, tiredness, flu-like symptoms. It sucks, right? You have flu-like symptoms. Do I have the flu? Do I have an arbovirus? Do I have Ebola, right? You could freak yourself out if you start to think about it that way. When there is a secondary viremia, that can spread the virus to other organs and lead to more severe disease. When you have one of the hemorrhagic viruses like dengue or yellow fever, what you're seeing is viral lysis of the vascular cells, but also immune lysis of the vascular cells. So part of that cytotoxic T cell response. Also, there is increased permeability of the blood vessels because of the various cytokines that are circulating. So, again, it really can come down to the individual themselves. Do you have a really robust or overactive T cell response? You may have more severe disease in this case. I did mention when we talked about the reoviruses how double-stranded RNA is a trigger that there's a viral response. And so what can happen is during viral replication, these viruses don't protect their double-stranded RNA like the reoviruses do. This double-stranded RNA is just out there in the cell like, yay, double-stranded RNA. But that triggers the cell to say, whoa, I'm infected. That leads to the production of interferon, which helps to limit viral replication and to stimulate the immune response. So that's when you're going to start getting those flu-like symptoms. First, you'll get IgM, as with any infection. Then you'll get IgG. Antibody can be important, as with all viral infections, because antibody can block viral attachment and spread. With some of the Flaviviruses, Dengue, Zika, West Nile, yellow fever, there are some common antigens, right? They're related. It's entirely, it totally makes sense, right? It's entirely plausible that they make common antigens. So sometimes there can be cross protection. So maybe you had yellow fever in the past, now you've been exposed to dengue, perhaps there's some cross protection. Or we actually have a yellow fever virus vaccine. So you're traveling to an area where it's endemic, you get the vaccine, maybe that helps protect you from West Nile, Zika, dengue. Maybe not completely, but maybe partially. Your cell-mediated immune responses are also important. They help get rid of virally infected cells. And that immune response is a double-edged sword. So why? What have we talked about so far that kind of leads you to, well, immune response good, immune response bad, right? Why is it both good and bad? With a lot of our alpha and flaviviruses, humans are often, but not always, a dead-end host. And this is because that we don't often get a high enough viral load in our bloodstream for a mosquito to pick the virus back up from us and transmit to another person. So there are some viruses that might get to a high enough level. For example, West Nile virus gets to a high enough level in the blood that it's a risk for people who receive blood transfusions. But with others, things like yellow fever, dengue, and chikungunya, humans do sometimes maintain a high enough viremia that the virus can kind of circulate through the human population. So they're showing that right here with dengue and yellow fever, like an urban cycle where the mosquitoes are feeding mostly on people and people have a high enough level of the virus in the blood that as long as the mosquitoes are feeding on people, you're fine. With something like West Nile, here they show a bird. Birds are one of the animals with West Nile that gets a really high viral load. So especially crows and related birds. Arboviruses most often occur during warm, moist months. During the winter, the virus can be maintained in the larvae or eggs or in infected hosts. Again, with a changing climate, with perhaps longer summers, weird weather patterns, will we see a spread of these vectors or a change in their life cycle? Maybe. So here what we're looking at are human disease cases of West Nile virus in the US. This is the most recent data. So you see, Fresno County. So some of these counties here that have decently high levels of West Nile. Here we have dengue. And again, we're talking only a few months of data, or like 2 months of data. So Puerto Rico has dengue. The majority of these cases are probably going to be travel associated. So the patient had been out of the country and then came back to the US and started to feel symptoms and sought medical treatment. But in Florida, sometimes there is local transmission. The majority of patients who experience symptoms, though, will only experience flu-like illness. And as we've talked about already, some of the major complications include encephalitis, so West Nile and all those other encephalitis viruses, hemorrhagic fever, which can be seen in dengue, Dengue is pretty common, 100 million cases per year, 300,000 deaths. There's also something called dengue shock syndrome, which is caused by the overreaction of the immune system to infected cells. Yellow fever can cause liver damage, GI hemorrhages, and when that happens, there's about a 50% mortality. So it's a very dangerous infection. And honestly, one of the reasons that the US developed a vaccine against yellow fever is because during the construction of the Panama Canal in the early 1900s, everybody kept dying of yellow fever. And so the Panama Canal region actually used to be controlled by the US. And so the army was down there like building the Panama Canal. And Walter Reed, the Walter Reed Medical Center is now named after him, was one of the physicians who kind of spearheaded the development of the yellow fever vaccine so that people could continue to build the Panama Canal. But even in places like Philadelphia, there were yellow fever outbreaks that would kill people. So in the US, because of the vaccine and because of our improved vector control, we don't see these infections like we used to or like we possibly could. Alpha and flavivirus infections can be diagnosed by serology or reverse transcription PCR. Unfortunately, there are no treatments. So really prevention is key. That involves elimination of the vector, mosquito repellent or tick repellent for some of those that are transmitted by ticks. There are some vaccines against yellow fever and some of the equine encephalitis viruses. I don't know why it says vectors. It should say viruses. I'll change it on the slide so that when you look at the slides, it'll say viruses. And there is a dengue vaccine in development.